My name is Alexandria Lamb, and I'm going to be talking about equine infectious anemia. Equine infectious anemia is a disease that has no vaccine, treatment, or cure. It's a reportable disease if a horse has it. I'm a registered veterinary technician, and I have been working and competing with horses since I was 15 years old. Some people may be ignorant to this disease and can simply endanger other horses by transporting theirs. We will talk about the disease family, transmission, clinical symptoms and diagnoses, and also the prevention and control to help better understand the disease. Equine infectious anemia is described by the current therapy in equine medicine by N. Edward Robinson in 1997. Is equine infectious anemia virus is a member of the lentivirus genus and a family of the retrovirinae. Transmission can be through blood-sucking insects like horseflies and deerflies. The disease can live in the mouthparts for 30 minutes to 2 hours, and we can also see transmission through contaminated needles and surgical equipment. Once a horse is infected, they have this disease for the rest of their life and will be carriers for the rest of their life, as stated by Joanna Bassert in McKernan's clinical textbook for veterinary technicians in 2014. Now that we understand the disease family and transmission, we can look toward the clinical symptoms and diagnoses. Clinical symptoms can be chronic or acute. Most horses will be asymptomatic, which means they do not show symptoms. Acute infections will see fever, lethargy, anorexia, petechia, pale mucous membranes, icterus, and neurological symptoms. On their blood work, we'll also see anemia and thrombocytopenia, or low blood platelet counts. In chronic infections, we'll see cycles of fever, anemia, thrombocytopenia, weight loss, and ventral edema, which is fluid buildup along the skin or under the skin along the abdominal and thoracic areas. The diagnosis of this disease is made by a serological test called the Coggins test, as noted by Kristen Holtgrew-Bowling in the Large Animal Clinical Procedures for Veterinary Technicians in 2016. Infected horses will have antibodies to the virus, so they will test positive for the agar gel immunodiffusion test or the enzyme-linked immunosorbent assay for equine infectious anemia virus, as recorded by Joanna Bassert in McKernan's clinical textbook for veterinary technicians in 2014. Now that we understand the clinical symptoms and the diagnosis, we can look to control and prevention. In the early 1970s, the Coggins test was developed. This test became the basis for state and federal control regulations that exist today. Referring back to N. Edward Robinson, who authored Current Therapy in Equine Medicine in 1997, the test must be negative for a horse to compete or transport. If the horse tests positive, it is reported to regulatory officials, and the owners and doctors will not know until after the report has been made. A positive horse cannot be transported on the interstate. A positive horse must stay 200 yards away from other horses or be euthanized. Prevention can be simple with fly control. So fly control can be spraying horses down and removing manure from the property. We also need to annually test all of our horses on the farm, and any new animals that come onto the farm must be tested shortly before coming. In conclusion, equine infectious anemia virus transmit through the blood, through blood-sucking insects, and can be a death sentence for any horse that gets it. Now that we understand the disease family, transmission, clinical symptoms, diagnoses, prevention, and control, we are understanding the disease better. With better understanding, owners can make responsible decisions when transporting, purchasing, and competing their horses. Go back to you guys.
I think you did it.